Accuristix is a third-party logistics company focusing in the healthcare industry, and we are one of Canada's largest operating in that sphere. Accuristix handles $7 billion worth of product on an annual basis. We have 7 warehouses totaling over 1 million square feet.
Our mission, and I quote, is to advance healthcare logistics through quality, excellence, and innovative technology. And that's where Tecsys helps us by delivering innovation solutions to our clients.
When we look at the healthcare industry as a 3PL, we need to make sure that all of our customers and all of our clients are getting exactly what they ordered, or somebody's life could be at risk on a daily basis.
Our clients put a lot of trust in our operations. We're a seamless extension of their quality system, so the room for error here at Accuristix is very, very low.
We always strive to make sure that our orders ship out with 100% accuracy. Tecsys Elite system gives us the visibility to our users and the audit trail history for Health Canada. As a healthcare company, we are required to keep transactional data for a minimum of 7 years past the date of the transaction taking place. Tecsys gives us the capability to have all information readily available. It's as easy as pulling up the client ID and the date, and I can see all of the audit trail history.
The great thing about Tecsys for us is that we're able to build automation into a lot of our error reporting. If there isn't, say, an error or some kind of problem, there's an email sent for that or an alert to the appropriate group who can action them, versus our legacy WMS where we had to have someone who would go in and watch for these or wait for a user to report an issue before we could action it.
Accuristix was running on a legacy WMS, and they basically outgrew it. There was an incumbent, but they decided to choose Tecsys.
We looked at our current legacy WMS and said, can we upgrade it? And to be truthfully, they weren't interested in letting us run the WMS the way we run it today. The things we really liked about Tecsys was that it's a modern platform, a SaaS solution for us, which is great. It's scalable, able to pump through volumes that we're not currently able to pump through with our legacy WMS, and then it's healthcare focused, just like we are.
We understand the business. We understand the hospital. We understand the distribution. We understand that patient is at the center of everything they do. Because of that, we have a lot of features built in, generic to the product, for healthcare. So that really helps them out of the box be able to optimize their warehouse and optimize their fulfillment.
We made the decision up front to create a special team entirely dedicated to making sure we have a smooth transition between our old system and Tecsys. Getting Tecsys enhancements working, getting it working within our environment and making sure it plays well with the systems we already have in place, and then working through the process on those migrations.
Our major goal through our migration process is to reduce risk. By going client through client, we're able to minimize that risk and focus on just the requirements of that customized solution that we've built for that customer at the end of the day. And we're able to use a partner, Avalon, to achieve that.
We are the integration partner on this implementation. We were getting all of the architecture, the solution design, the business process mapping done. We want to make sure that it's as foolproof as possible, that human error does not come into play.
In the healthcare world, you need to be accurate 100%. That's why we have such a robust process getting the system conversion in place, and that's why we really can't accept anything less than 100% success rate at that go-live stage.
Through our process, we've been able to seamlessly migrate. We shut down business on a Friday, we migrate the client, and we're back open Monday without any disruption whatsoever.
Because as a 3PL, they are dealing with a large swath of customers who have different requirements. They're going to need a lot of customizations in their product.
We can talk about different storage areas. So we have our liquid nitrogen, our ultra cool freezers. We have multiple cold chain fridges from 2 to 7 or 2 to 8. We have ambient, we have dry, controlled drugs, narcotics, precursors. On top of that, you talk about client-specific EDI requirements where we've had to customize mapping, or how our clients want us to pack out and handle their product. And we're very flexible to be able to support all of those.
Initially, we were designing for the entire network, knowing that we were going to be going live in a phased approach, client by client. We have been at it now for close to 4 years. A lot of new clients came on board, new requirements came on board, and we were able to solution them through the Itopia platform.
Itopia is a low-code application platform that underpins all of Tecsys' Elite suite of supply chain solutions. So what that enables you to do is customizations, personalizations in the software without actually changing the underlying source code. Changing source code is long, it's time-consuming, and it's costly.
Using Tecsys functionality and using Itopia, we've been able to eliminate probably at this point 50% at least of our manual solutions. In my opinion, a manual process means you're open to making an error.
In our legacy WMS, we had to communicate a lot of different things to our users through paper. We weren't able to get them onto the screen because the screen was protected source code. In the Tecsys WMS, we're able to now alert users of different requirements, different processes that have to be followed.
We've put in prompts using Itopia to tell a user if you're picking item A and it requires you to pack it out in a specific pack out, it'll send them a prompt message where they can acknowledge, and that acknowledgement also gets tracked for us to go back in our audit trail history and show Health Canada when we do get audited that yes, we are showing this information to our users to help them make informed decisions on what to do.
I'm very proud to work for Accuristix and work in healthcare logistics. We're not just shipping boxes in and out, we're really delivering life-saving medication that is affecting people's lives.